Okay. What advantage is there in employing external consultants to work in public health roles?
Well, if I might answer that question in the context, rather than theoretically, but in the context of what we're doing in Test and Trace, if that's all right. We stood this service up in May at extraordinary speed. As I say, we've built something that is the same size as ASDA in the course of 5 months. And when you start something very quickly, you need to pull on all of the talents across all of society. So when we first started, we had significant resource come from the military, from the civil service, but from the NHS and also from the private sector. And when you don't know what you're building, you can't offer people permanent jobs when you don't yet have a permanent organisation. So you have to employ people either as independent individual consultants or through consultancy organisations. And that's one of the important components of building the system. And, you know, we've built something really with the talents across society.
Dawn, final question.
Absolutely. Sorry to disturb you. I agree, but I just think, could civil servants not have done that job rather than employing external consultants? And Byline Times recently revealed that outsourcing giant Capita was paid £1,800 a day to supply senior staff. That's the equivalent of £500,000 a year when a civil servant could have done that job. Do you think that's actually value for money, Baroness Harding?
We need both. So we've got fabulous civil servants who've been working every hour that they have on Test and Trace, but to stand a service up at this speed, we've needed to call on the talents across the whole of society, both public sector and private sector. As the organisation becomes more established and more permanent, we're able to offer people more long-term permanent jobs, and we're seeing the proportion of civil servants grow. But you know, the teams from the military, from Deloitte, from other consultancies have done extraordinary work together with our brilliant civil servants and NHS colleagues, and I'm really proud to be representing all of them.